welcome once again to another edition of Good Books. I'm your host this week, Dr. John Cook, and with me today is Alan Francis, MD. He was the chairman of the DSM-4 task force and part of the leadership group for DSM-3 and DSM-3R. We'll talk about DSM a bit. He is also professor emeritus and former chair of the Department of Psychiatry and Behavioral Science at Duke University School of Medicine. And the book that we're going to be talking about today is Saving Normal: An Insider's Revolt Against Out-of-Control Psychiatric Diagnosis, DSM-5, Big Pharma, and the Medicalization of Ordinary Life. That's a lot to tackle. Dr. Francis, welcome to the program.
Oh, good morning, and thank you for having me.
This really has a clear progression to it. It's an easy-to-read book, and it talks about a concern that we all should have about people being diagnosed too early, too quickly, too easily, and treated often with medication that may not be needed. Let's just start with what's normal and what's not. What would you say about that?
Well, I wish there were a simple answer to that. If there were, we wouldn't be in this fix. There's no biological test for any of the psychiatric disorders. So they're all defined by criteria, which I was involved in writing over the many years, that hope to describe people in a way sufficiently clearly so that there can be agreement. But the criteria for mental disorders are fallible and they're subjective and very much subject to being misused. So the boundary of normality can be easily expanded by something as simple as an active drug company advertising campaign to the public and aggressive marketing to doctors. There's nothing that holds the line that prevents the misuse of psychiatric diagnosis and the excessive use of pills, except an informed public and a press and media like you, I guess, trying to explain to people that there are risks as well as benefits to psychiatric diagnosis and to medication treatment.
Mm-hmm. In some cases, we have measurements, and I think you convinced me when you used the statistical example of standard deviations and the IQ. Is someone not able to do normal school work if they have an IQ of 70, but what if they have an IQ of 71? Why is there a cutoff at certain points? I think that's when I began to see how arbitrary.
Yeah, I think the issue here is that if people have severe, clear-cut psychiatric problems that occur in many areas of their lives and persist for a long time, and it's absolutely clear-cut. Anyone can tell when a psychiatric disorder is clear-cut. And those patients definitely need medicine. We're neglecting them. In a shameful way, we have 1 million psychiatric patients in prison because we don't provide adequate treatment in the community, a decent place to live. So the argument is twofold. One is that there's a cruel paradox. Part of it is we need to be identifying the people who really need help and giving them much more help than they're getting. On the other hand, at the fuzzy boundary with normal, which is really heavily populated, lots of people could be ruled in or ruled out depending on just a slight change in wording in the criteria or the way drug companies advertise. At that boundary, way too many people are considering themselves sick and taking pills that they don't need. Mm-hmm. And what we need to do is to give better care to the really sick people. And for many, the millions of Americans who are taking pills they don't need, helping them to figure that out and then giving them an easy and graceful way to get off medicine without getting withdrawal side effects.
Mm-hmm. Let's talk about the DSM for those that are unfamiliar with it and defining individual mental disorders.
Well, yeah, I started working on this in 1975, and I was the chair of the DSM-4 task force that came out with the volume in 1994. It's a very valuable document that's been greatly misused. Mm-hmm. The idea is, given the lack of biological tests to define mental disorders, we have to do it by setting up criteria. If you have major depression, you have to have 5 of these 9 symptoms. And this is a way of getting agreement amongst people. If we don't have that agreement on diagnosis, then we can't do research, we can't do treatment practice guidelines. The field's a mess. So the DSM is a very useful document. The trouble is that it tends to be worshipped as a Bible rather than used as a tool. And particularly, it tends to be misapplied under pressure from especially drug company advertising, so that the average person is seeing a primary care doctor for 7 minutes. And most of the psychiatric medicine that's being prescribed now is by primary care doctors. after these 7-minute visits, under tremendous pressure from drug company salesmen. The patient's been primed by commercials on TV, the internet, in the press and magazines, to think that psychiatric disorder is easily diagnosed, often missed, always due to a chemical imbalance, easily treated with a pill. So the patient comes in asking for a pill for the problems of everyday life, and the doc, after 7 minutes, a primary care doc without much training or interest in psychiatry, gives the pill. It's the easiest way to get the patient out of the office, or a free sample. Mm-hmm. This is great for drug company profits. What they want to do is get everyone feeling they're sick, because that makes for a big customer base, and they've expanded from the adults to the kiddies and to the elderly folk. They're trying to get everyone on pills, but it's really bad for those people who don't need them, because they don't get benefit. Pills don't treat the everyday problems of life. They don't get benefit, but they do get the risks.
Mm-hmm. I recently saw a documentary that I've been trying to see a long time called Selling Sickness, and you refer in your book to disease mongering. And one of the interesting points is that while at the extremes, completely well and completely sick are perfectly plain distinctions, but there's a fuzzier distinction for the mildly ill, and probably most normal people have occasional symptoms: sadness, anxiety, sleeplessness, sexual dysfunction, and those could be misconstrued as mental disorder. And that happens, you say, in part because of disease mongering and the fact that pharmaceuticals are exemplary profit-making machines.
Yeah. Medicine that's excellent for the few can be dangerous and unhelpful for the many. And what happens is medicines get approved with an indication that's usually worthwhile for people who have really severe disorder, but then that's a small market. The drug companies don't care about that so much. Their focus is in expanding the use well beyond the original indication, so that most people feel that they have a problem that needs a pill. The human condition, the existential state of being us, is filled with distress, sadness, worries about the future, trouble sleeping. These are all part of life. We've been experiencing this for 150,000 years we've been on Earth. There's no way of avoiding it. We wouldn't be able to experience these emotions if they weren't adaptive. They serve a purpose. People who can't worry and feel sad aren't normal. Sadness and worry are part of normal everyday life. They're useful. What the drug companies have done is distort the manual in a way so that these are seen as psychiatric disorders, a chemical imbalance. Just take this pill and everything will be fine. And when people take happy pills, we get a pill-happy society, which doesn't function very well. And today, each day, 20% of our population takes a psychiatric pill. 20%. We have a tremendous problem with prescription addiction. 6% of the population is addicted to a prescription drug. And these can be very, very dangerous drugs. There are many, many, many more deaths now from prescription medication than street drugs. Mm-hmm. So the combination, particularly of prescription narcotics and benzodiazepines, kills tens of thousands of people a year, many more than cocaine, heroin. We're fighting the wrong war on drugs. Instead of trying to fight this futile 40-year war against street drugs, we should be regulating the way drug company products are prescribed and the way they're delivered at pharmacies.
Yeah, that was an interesting fact you cited, that the illicit drugs are now more of a problem than the illicit drugs.
Yeah, and it's not just, it's also interesting. Recently, I've seen stuff on ADD stimulant drugs, and I knew before that 30% of college kids and 10% of high school kids are able to buy ADD drugs that secondarily get diverted to the market. Someone goes and gets a prescription and sells it to someone who sells it to someone. But it gets worse. It turns out now that there's been a 4-fold increase in just the last 6 years in emergency room overdoses because of stimulant drugs. And more than 10,000 of these every single year. So we have a kind of glut of drug company drug pushing that's resulting in a dangerous public health situation. And the drugs are useful for their original indication. So people who need them have trouble getting them. That's the irony. Whereas people who shouldn't be taking them have all too ready access.
Mm-hmm. And in addition to the private practice doctors that are diagnosing these things to excess, sometimes people turn to neurologists, and they have they don't have that much training in psychiatry, which is one of the issues as well, isn't it?
Yeah, what happens is the drug companies did the math, and they realized that there are only about 40,000 psychiatrists in America. There are well over 500,000 primary care doctors. So they weren't going to get rich just marketing to psychiatrists. They do that, but the real mother lode of profitability comes from getting every primary care doc inculcated, propagandized with the idea that it's going to be easy for him to diagnose psychiatric practice and he'll make his patients happy by giving pills. Now these guys, some of them are great, but many of them have very little interest or training in psychiatry. They just don't have the time. I mean, we need to have many more primary care docs in this country and fewer specialists, because the primary care docs can serve a valuable function, but they just don't have the time. And if they have to turn over patients every 7-8 minutes, the easiest way to do that is to reach for a pill, write a script, or give a free sample. And they've been trying to do that by the salesman, the drug company salesman, and the patients come in, misled by all this advertising. Ask your doctor. If a patient asks a doctor for a particular pill, they're 20 times more likely to get it.
Mm-hmm.
And so this advertising is everywhere. It's affecting the way we understand ourselves as people. It reduces our sense of resilience and the ability to handle problems. Most of the prescriptions are necessary. It turns out that the placebo response rate is very high for the average patient coming in with emotional distress. At least about 50% of people are going to feel better in the coming weeks. So people go to their docs on the very worst day of their life. If you do nothing, you're going to feel, more than half are going to feel better. If you do little things to change your life situation or maybe to see it differently, or get psychotherapy, you're going to get a rate of improvement that's just as high as medication. But once you take the medicine, you don't know you would have gotten better anyway. You think it's because of the medicine.
Mm-hmm.
And people will stay on pills for a lifetime, despite the fact that they're not useful and that they cause side effects. So I think it's very important that we get this message out. It's very important that we not have the idea that every problem in life has a pill solution,
mm-hmm.
and that very often the problems of life will get better on their own, and that the pills will have long-term harmful effects without having given any much efficacy in the short term.
Mm-hmm. You talk articulately about that homeostasis and resilience of humans, but then there's all these causes of diagnostic inflation. There's fad diagnostic inflation, new fads. Let's talk about that for just a second.
Yeah, the history of psychiatry is unfortunately a history of fad diagnoses, and in the book I spell out a whole bunch of them over time. They always seem quaint when you look back on them. But we have our fads now. So right now we have a fad of attention deficit disorder. We have a fad of autistic disorder, childhood bipolar disorder, adult bipolar disorder. That suddenly, out of the blue, you can get sudden jumps in the rate of a disorder. So like ADD, attention deficit disorder, tripled in the last 20 years. Autistic disorders increased by about 50 times in the last 20 years. Childhood bipolar disorder, 40 times. Adult bipolar disorder, doubled. The thing that I think needs to be understood is that people don't change fast. Human nature is probably the same now as it was 50,000 years ago. The symptoms we have now are not different than the symptoms our grandparents had. What changes very rapidly is how we label symptoms. That can change with a flick of a pen. A small change in the criteria for how many symptoms you need for depression can result in jumps of millions and millions of people who previously weren't diagnosed depressed now will be. They can also be changed with the advertising I talked about, so that if we see our problems as mental disorder, if we think that our kids are sick because they're a little bit active, or that we're sick because we're feeling sad when we lose a loved one, that can result in a fad diagnosis. And the problem is that for the last 20 years, the fads have been triggered and pushed forward commercially.
Mm-hmm.
If it's in the interest of the drug companies to have more people sick, they're able to, with their billion-dollar advertising budgets, to convince doctors and patients to misconceive the problems of everyday life and mental disorders. I'll give you a great example of this. This was first done in Canada with 1 million kids. It's been confirmed in several other countries. The best predictor of ADD in kids
mm-hmm.
is their birth date of birth. If you're the youngest kid in the class, you have almost twice the risk of being diagnosed as having ADD than the oldest kid in the class.
In other words, if you're immature and underdeveloped.
Simple immaturity that you grow out of is now being mislabeled as a disease and treated with pills.
And there are several contributing factors to that. You mentioned Big Pharma's direct advertising of drugs, which you'd like to take out of the formula. But there also have been a lot more easy-to-use drugs as the drug companies research and develop new pills for stuff.
Well, drug company research has been remarkably unproductive. The first pioneering drug in each class, the antidepressants, antipsychotics, anti-anxiety agents, sleep medicines, developed 60 years ago or more. These are just as effective as the current drugs. There's never been a drug developed by a drug company that's more effective than the drugs we had 50, 60 years ago. What they have done is tailored the side effect profiles. In some ways that's useful, in some ways not so useful. So the side effects of many drugs are not as apparent to patients, and it makes it easier for people to take medicines they don't need. But in some cases, this hasn't eliminated the risk. In fact, the risk can be greater. The best example of this is antipsychotic drugs. They cause a lot less discomfort on a day-to-day basis, the new ones do, than the ones we had 50 years ago. However, they do something much worse. They cause obesity, sometimes massive obesity. A kid can gain 10% of his body weight, go from 110 to 122 pounds in just 3 months. We already have an obesity epidemic in adults and kids in the U.S. We don't need to be giving them medicine that's going to increase their risk for diabetes and for heart disease and maybe a shorter life expectancy for indications that don't make sense. But it's being done all the time. Every conduct problem in kids now becomes a discussion about should this person be on an antipsychotic drug. We have little evidence that they help, except in the short term to, turn the kid into a zombie. We have a lot of evidence that they can cause serious medical problems in the long run. Now, I'm all for the medicine, so that's an important point. I really believe in these medicines, but I believe that a drug that's very, very good for the few can be very, very dangerous for the many. And what we've done is take the medicines out of their proper indications for the few, and they're being spread around like candy for the many.
I remember in the 80s that Xanax was like that, and you talk about Xanax being quite addicting, and in overdose, particularly when mixed with alcohol, it can even depress respiration. And then came some drugs that were easier to use, Zoloft and Paxil and Celexa, which became bestsellers.
Xanax is still a bestseller. It's been off patent for a long time, but people like to take it because it's over like a shot of alcohol in a pill. The trouble with it is that the doses that work are just about the same as the doses that are addicting. The medicine is being given out mostly by primary care doctors. Psychiatrists usually know enough that this is a useless drug and a dangerous drug. But the scripts are being written by primary care docs, 90% of them. Still one of the most popular drugs in America. Shouldn't probably be on the market at all because the risks far outweigh the benefits. But there's no way of sunsetting drugs. That once a drug gets on the market, it's very hard to take it away. And it's really a form of pill pushing now that so many people are taking. And it's really dangerous, especially in combination with narcotics and alcohol. And is responsible for a fair number of those prescription deaths.
You mentioned...
Oh, let me say one thing about that, though. I have to say this. No one should listen to this program and stop their medicine.
Right.
Especially Xanax and benzodiazepines, because they can have terrible withdrawal effects, much worse than the reasons the person originally started with them. Some people actually need the medicine, and almost everyone on medicine will have withdrawal symptoms if they stop abruptly. So you need to have medical supervision for stopping. It's probably going to take months, not weeks. No one should ever listen to me stop their medicine because you can get in real trouble doing it abruptly.
Very good. You mentioned Big Pharma being, I think, it was a $700 billion industry. And one of the points that I enjoyed reading was the Drug Company Hall of Shame. Because they can, take a big hit because they make so much money. They can take a big hit in fines and settlements and still be just fine as a profit-making entity.
Yeah, in the book, there's a table, that Hall of Shame table, that lists about a dozen different huge fines over the course of the last decade. The biggest is about $3.3 billion. The drug companies see this as chump change. They're being fined sometimes for criminal activity, actually criminal activity in the way they've advertised. And when you see the internal documents of the companies, it's not like this is happening by accident. It's an absolute strategy because it enhances revenue to be misleading the public. But the $3 billion hit doesn't really matter when, in total, the antipsychotic industry was until recently about $18 billion a year. The antidepressant industry was about $12 billion. Stimulants have jumped from they were only about $40 million 20 years ago. Now it's approaching $10 billion. These are really big bucks, and drug companies are willing to do illegal, unethical things to sell product. And if that means taking an occasional $1 billion a year fine, that's chump change for them. Until executives get hit personally in a big way or get put in jail, until it has a real impact, not just a $1 billion fine, they'll keep doing this. And even more, this is the only country in the world aside from New Zealand that allows drug companies to advertise to the public. That this is defended by them as free speech. That's nonsense. They don't have the right to mislead the public into taking drugs that are very harmful for them. But they have tremendous power in Washington, and they really control the legislature, and the people responsible for worrying about the drug companies often wind up working for them right after they're done with government. Vice versa, the lobbyists write the laws. This won't stop until there's enough public outrage. It's very much akin to big tobacco 25 years ago. Mm-hmm. Big tobacco was in the same kind of all-powerful position until there was just so much public outrage about the misleading and really dangerous things that they were promoting that the legislators were shamed into responding to the public instead of the big money. And my hope is that for Big Pharma, the same thing is happening. They really are outrageous. And the more people understand that, they're not your friend when they're advertising. That's not for your sake. They're doing it for the shareholders and the execs' bonuses. The more people realize the dangers of pills, not just the benefits, I think the quicker will legislators catch on that they can't allow this kind of wild, reckless misinformation being sold to the public.
Couple of other influences. One is the school system itself. I have talked to a lot of mothers who have had a kid diagnosed autistic or attention deficit disorder, and there are special programs for them, and that is part of why diagnosis is increased in children, in addition to Big Pharma.
Yeah, for sure. It's very dramatic with ADD. The class sizes are way too big. Mm-hmm. School budgets have been strained, and one of the things they do is fire the gym teacher. So you have fidgety kids who don't get to exercise during the school day. And the easiest solution for teachers, if they've been brainwashed by drug companies, is to think, well, if we take the 2 or 3 kids that are most active and quiet them down, the whole class will quiet down. We shouldn't be spending $10 billion on ADD drugs and giving them to immature kids in class just because they're immature. What we should be doing is spending more in schools, more gym classes, smaller classes. We shouldn't be medicalizing the problems of the schools and trying to find a solution in a pill. We should be solving the problem in the schools themselves. Similarly, with autistic disorder, the rate jumped 50 times. Again, we don't have more autistic kids. We just have a change in labeling that comes about largely because it's the only way for kids who need it to get more educational services. Mm-hmm. Should be a completely different approach. We didn't design the diagnosis of Asperger's thinking about its use in school systems. We were thinking about the clinical practice, not the educational practice. If kids need more school attention, they should get it for their problems, not for a fake diagnosis. And lots of kids who get the diagnosis of Asperger's or autism are really not autistic and would be they're mislabeled because of careless diagnosis, pressured by the availability of more services. Many of those kids carry the scar of the diagnosis, are haunted by it for many, many years, maybe a lifetime. It would be better for educational decisions not to be based on a DSM manual that wasn't meant for that purpose. Educational decisions should be based on educational need by educators using educational instruments, not a fake diagnosis of mental illness that could have such harmful stigmatizing effects. Mm-hmm.
So we talked about autism and ADHD as a couple of fads, and we're making more kids bipolar, but we haven't yet mentioned social phobia, which has turned everyday shyness into the third most common mental disorder.
Yeah, I think that's one of the things I'm embarrassed about. I was part of the decisions that included social phobia in DSM-3R and that continued it in DSM-4. And we had in mind the person who really couldn't function, who was losing their job because they couldn't face the other people at work, couldn't go to a meal with coworkers because they were so embarrassed about everyone staring at them when they put a fork in their mouth. It was really meant to be for severe, debilitating, pervasive, long-standing social problems that were of great distress and really impairing the person's ability to function. But what happened is that kind of diagnostic slippage, that you start out with something that's meant for only the most severe patient, and before long it's being used for people who have normal shyness. And that everyone who's having trouble going into a social situation for any reason. We all have trouble at parties, and we do surveys. One of the most stressful things for any individual is to go to a party alone. If a person has trouble going to a party, if a person has trouble worrying about a business presentation, eating with strangers, this is absolutely normal. It's a human condition. It shouldn't be diagnosed with social phobia, but there are only very few people who have the really severe classic form of social phobia that does require treatment. There are millions and millions and millions and millions of people who are shy. Most of us are shy. The more the drug company can convince the millions that they have a mental disorder that requires a chemical solution because it's caused by chemical imbalance, the more they can laugh all the way to the bank. And what we have to do is get back to a much stricter application of the criteria, and the public needs to protect itself. People need to be informed consumers, realize that the whole pill thing has been way overdone, and protect yourself, and even more important, protect your kids from pills that may not be needed and can have really bad side effects.
We only have about 3 minutes left, unfortunately, and I wanted to talk about overdiagnosis of PTSD, but I think I'd rather turn to recommended solutions, because the book does a good job of that. It talks about DSM-5 and some of the bullets that were dodged from creating too many new things, but you have a complex formula, really, to tame this problem. You want to talk a little bit about that?
Yeah, the monster can be tamed. We've seen that with big tobacco. David sometimes wins battles against Goliath. We need to tighten the diagnostic system. We need to re-educate doctors, psychiatrists, but particularly primary care doctors, on the value of doing less rather than more. That more medicine is often bad for your health. We need to really tame the monster of Big Pharma and not let them. And the way to do that is the same way we did it with tobacco. Don't let them advertise. Don't let them market. The truth will reduce this explosion of pill taking once they're not allowed to distort it. We need to change insurance companies so that your doctor now gets paid only if he diagnoses on a first visit. Psychiatric diagnosis is like buying a house. It's a really important moment in a person's life. Done right, it's wonderful. Done wrong, it can be terrible. So we should allow docs 5-6 visits before they come up with a diagnosis. If you postpone making a diagnosis, you often won't need it because the problem gets better on its own. We need to inform the public, and that's where you and the press come in. In the old days, the press was always talking about how wonderful the new pill is. I think you guys have become really skeptical in an appropriate way, and you have an important job in changing public opinion. We can't do that. The docs can't do that. I think it's really crucial that the media does it, and I'm really glad to be on this program and thankful to you for such an intelligent interview, because I think people listening to it will catch on to the fact that it's important to protect yourself from overdiagnosis and overtreatment.
Indeed. This is a very important work to my way of thinking as well, Dr. Francis, and I appreciate the chance to talk to you. We've been talking with Dr. Alan Francis about the book Saving Normal. The title caught my eye, but once I read the book, I realized how important it is for everyone to get informed of this. I'll remind you, our listeners, on Public Radio 88 FM, if you don't hear our show between 12 and 1 on Thursday when it's played twice, or Sunday mornings at 6:30 a.m. and 2:30 p.m., you can catch us on YouTube. Just use the search engine and look for Good Books Radio Strong and Cook. We are underwritten by audiobooks.com. Try one for free. I'm your host, Dr. John Cook. Thanks for listening.